Welcome to the Columbus Report, where Waycross connects you to what's going on in our government at the state level. We've just survived a midterm election, and we saw an increase in voter turnout both at the county and the state level. In presidential election years, we see turnout numbers close to 70%, but for midterm elections, the average is around 50%. This year, we saw 53.5% of Ohio voters cast a vote. And here in Hamilton County, the percent was 55.68. A quarter of those Hamilton County votes were absentee or early ballots. We had this time a statewide issue on the ballot. That was Issue 1, Proposed Constitutional Amendment to reduce penalties for crimes of obtaining, possessing, and using illegal drugs. That issue did not pass. And we had several state representative races in our Waycross area where we saw incumbents hold on to their seats. We had the 28th district where Jonathan Devers slightly edged out Jessica Miranda. We also had votes for write-in candidate Regina Collins. We have the 29th district where Lou Blessing managed to hold on to his seat over Carrie Davis. And we have the 30th district where we saw William Seitz hold on to his seat over Clayton Adams. Now, at the time of this recording, the 28th district is still too close for an official result. So we're going to have to keep an eye on that race between Jonathan Deaver and Jessica Miranda. Now, while our state officials settle back into their duties after midterms, we will take this opportunity here on Columbus Report to join Governor Kasich and Director of Mental Health and Addiction Services, Mark Hurst, at a press conference this fall to discuss progress in Ohio's fight against opioid abuse.
Director of the Ohio Department of Mental Health and Addiction Services, the 2017 drug overdose death data has been finalized by the Ohio Department of Health. The good news here is that we continue to make progress on the prescription drug front. Prescription drug-related overdose deaths have reached an 8-year low, and heroin-related overdose deaths a 4-year low. Ohio has made significant gains in reducing the number of prescription opioids available for misuse, and as a result, prescription overdose deaths that also don't involve fentanyl are at their lowest since 2009. The number of prescription opioid-related overdose deaths declined 7% from 2016 to 2017 and has declined nearly 28% from 2011 to 2017. This is significant because I think most of us know that prescription drugs are often the gateway to heroin, fentanyl, and other illicit drugs. So it's really important that we've made this kind of progress. There is correlation between the decline in prescription opioid deaths and the efforts we've made to reduce prescription opioid drug supply that's available for diversion and misuse. These have included things like putting in place prescribing guidelines and rules, strengthening prescription drug monitoring, stepping up enforcement efforts, and the new regulations for drug wholesalers. While the data shows that Ohio's efforts to curb prescription opioid overdose are working, the driving force today is unintentional overdose deaths that are due to illegally produced fentanyl. Not only the fentanyl alone, but also fentanyl, which is sometimes mixed with other street drugs like cocaine, heroin, and methamphetamine. Last year, we had 4,854 unintentional overdose deaths, and illegally produced fentanyl and related drugs like carfentanil were involved in 71% of them. We also had a 39% increase in cocaine-related overdose deaths and 130% increase in overdose deaths involving psychostimulants like methamphetamine. Many of those deaths also involved fentanyl and related drugs. However, the data also indicates some promising news. In the second half of 2017, overdose deaths statewide decreased by 23% compared to the first half of the year. We continue to be seen as a national leader in approaches to curb the opioid epidemic. Expansion of prevention, evidence-based treatment approaches, and life-saving measures such as naloxone are keys to that multifaceted approach. The resources that have come forth because of Medicaid expansion have allowed many more Ohioans to access needed treatment for opioid use disorders. And in fact, in 2017, 95.6% of those with an opioid use disorder who enrolled in Medicaid as part of the expansion group received such treatment. Additionally, Ohio applied for and recently received a federal grant of $55 million to continue to aggressively address the ever-evolving opioid issues. We'll use the funding to support local community efforts, expand workforce and access to treatment, strengthen supports for people in recovery, and invest in supports for children and families who have been impacted by the epidemic. Ohio's prescription drug monitoring program, called ORS, is an important component in our fight against prescription drug abuse and a contributor to our progress. Next, my colleague Steve Shearholt, the Executive Director of the Ohio Board of Pharmacy, will explain how ORS works, why it's important, and some key metrics. Steve.
Thank you, Dr. Hurst. My name is Steve Shearholt. I'm the Executive Director of the Ohio Board of Pharmacy, and I am going to talk about ORS. ORS stands for the Ohio Automated RX Reporting System. It's Ohio's prescription drug monitoring program. Every state in the country has one, and what it measures, it tracks all of the prescription controlled substances that are dispensed in Ohio in an outpatient setting. And not bragging, just factually stating, Ohio is truly a leader in the prescription drug monitoring program space. Ohio was the first state in the country to implement and fund the integration of the prescription drug monitoring program into the workflow. One of the problems nationwide was the fact that ORS was a standalone system and not integrated with the pharmacy management systems or the electronic medical record programs. And in Ohio, starting in October of 2015, Ohio has implemented that integration. Secondarily, a product called Narcs Care that many states have, but Ohio is funding that for our prescribers and pharmacies. It went live November of 2017. It has prescriber tools, prescriber reports, and overdose risk scores that ideally, with all of those, it gives the physician an opportunity to have a different conversation with the patient. When they're using ORS and seeing some of these key indicators, our desire, and I think it is happening, is the physician is better positioned to have a different conversation with their patient. So why is ORS so important? As Dr. Hurst just said, annually, over 80% of the decedents of unintentional drug overdose deaths have a history in ORS. And in fact, in 2017, that number was 83%. And ORS uses, again, ORS is where the complete prescription controlled substance history is for the patients in Ohio. The physicians and pharmacists have the ability to look for drug interactions, know with confidence they're not duplicating therapies, watch for doctor shopping. And doctor shopping, I think it's on the chart here, but doctor shopping has gone from 2,205 individuals in Ohio in 2011 to just 273 in 2017. The integration into the clinical workflow has been a game changer, and you'll hear more about that from a daily user. But in July of 2011, the ORS system averaged 4,000 queries per day. And in July of 2018, that number was 521,000 queries per day. And in fact, before I came over here, I got an update for August, and it was 599,000 ORS queries per day. With this integration, what we are trying to accomplish, and one of the things we're trying to accomplish, is give the physicians back some time. I think everyone that follows this issue recognizes that with physician having time with their patients, there is likely a better clinical outcome. And with this ORS integration, we are trying to give the physicians back some of that time. And with having that tool available to them and the obvious exponential increase in use, we believe we're saving lives as well. One of the other features of ORS and one of the other uses is identify aberrant behavior. There are, as I'm sure we all know, there are pharmacists, physicians, nurses, dentists that engage in improper conduct. And using the data from the ORS system, we are routinely able to identify that bad behavior and either pursue it or route it to the licensing board for administrative action or criminal prosecution if it calls for it. ORS is enabling us to be data-driven. The acute pain rules that went into effect, honestly, the decision to set that at 7 days and 5 days versus 5 days and 3 days was largely due to the data that we were able to look at in ORS and determine that the sweet spot, if you will, or the starting spot was that 7 and 5. ORS is able to provide to the prescriber boards compliance reports and through ORS with wholesale sales data and the new rules regarding suspicious order reports. That's just another way that the ORS system can lead us to data-driven policy decisions and enforcement actions as necessary. So a little progress in ORS. From 2012 to 2017, Ohio has seen a reduction in opiate unit doses being dispensed of 225 million, benzodiazepines, 64 million doses, prescriptions for controlled substances, 3.3 million reduction, and the number of Ohio patients has been reduced by 1 million. In closing, I would like to recognize the doctors, the nurses, the dentists, and the pharmacists that have brought us this progress and the ORS use and that type of metric. You know, we cannot fight our way out of this without them being on board. And I think the numbers and the statistics that I've given you do show that the medical community is seeing that they need to be part of the solution and are working to be such. Now you'll have an opportunity to hear from someone who works with ORS daily. We have Denise Conway is a pharmacist and owner of Conway's East Side Pharmacy in Mount Vernon, Ohio, and a frequent ORS user. So, Denise.
Thank you. Like Steve said, my name is Denise Conway. I'm a pharmacist and pharmacy owner of Conway's East Side Pharmacy in Mount Vernon. Since the inception of the ORS program, it has grown and evolved into an impressive database that has become a national standard for prescription drug monitoring. The evolution and growth of this important tool has been highlighted by the recent integration of ORS directly into electronic medical records and the pharmacy dispensing systems across the state of Ohio. This integration was due in great part to the investment that Governor Kasich made in 2015 and has allowed tremendous improvements in the pharmacy workflow to remove the logistical barriers that we had from the older system. As my pharmacy was one of the earlier sites to participate in the integration period, my staff has gained essential workflow time by being just one click away from the ORS database, rather than operating between two websites and eating up a lot of minutes while filling prescriptions. This time savings has allowed our staff to spend much more time with our patients and with their care. So the benefits that the ORS database has given the pharmacy staff and the collaborating medical teams are endless. The ORS system is used in an enormous amount of times each day by healthcare professionals to assist in care of their patients. Pharmacists encounter difficult and uncomfortable situations all the time with patients and doctors on a regular basis when we reference the ORS database, when we reveal a suspicious prescription or some unscrupulous activity by an individual. By having this crucial information at the forefront of filling prescriptions, pharmacists and prescribers can quickly and congruently work together to convey any concerns that may have been discovered by just checking this database. There are many examples I can share, but I'll share just one with you today. A long-term patient of mine was suffering from a painful condition. That patient ended up addicted to opioid medications. thus because they were being prescribed medications to control their pain. But unbeknownst to the patient's medical team, that patient was receiving addiction treatment therapy. That patient then reached out to a doctor expressing an increase in pain. That patient then received a pain medication. That prescription then came through my pharmacy. And without the ORS database, without that information in front of me, I was able to discover that this patient was undergoing addiction treatment. So, if I didn't know about this addiction treatment, I really could have severely compromised the patient's treatment in multiple ways. This is just one of many examples of how ORS and its database has had an incredible impact on healthcare professionals like myself, but also citizens of the state of Ohio. So I can't believe that all states have not implemented prescription drug monitoring programs that are as robust and intuitive as ORS. But I hope they do see Ohio's success. I hope they work to model that in their states. I thank Governor Kasich and his administration for the investment that they've made in ORS, because the investment is to not make our community healthier and safer. Next, I'd like to introduce Frank Migliozzi as our next speaker.
Thank you. I'm Frank Migliozzi. I'm the Health Commissioner for the Trumbull County Combined Health District. Trumbull County's age-adjusted overdose death rate involving prescription opioids is amongst the highest in the state of Ohio. Fortunately, we were awarded a federal grant through the Ohio Department of Health aimed at increasing our efforts of prevention to prescription drug overdose abuse efforts. Our community efforts include the development of a community response plan to increase the response to drug overdoses. We also developed an overdose fatality review committee to analyze overdose death cases, to inform prevention efforts, and to evaluate strategies. Furthermore, we expanded community access to naloxone to reverse opioid overdoses and to save lives. We have also trained physicians, medical students, medical residents, dental students on opioid prescribing guidelines and the use of the ORS system. Furthermore, we have introduced youth drug abuse prevention initiatives in several of our school districts. And finally, we have developed public service announcements regarding safe prescription drug storage and disposal methods, which also included a movie theater preview, and we got a great response from it. Several of these strategies also address the opioid epidemic that goes above and beyond the prescription drug abuse, as we have experienced an increase in the use of heroin and fentanyl in our community. Although it's early and we still don't know the full effect of these initiatives, I can tell you that we are optimistic about the number of drug overdose of our efforts, because drug overdoses and deaths are trending downward in Trumbull County this year. Community collaboration and engagement are the key to combating the opioid epidemic and saving lives. And this type of funding is crucial, especially in our community, for these efforts to continue. And John, I'm sorry, I can't remember your last name.
I got it.
Thanks.
Well, good afternoon. My name is John Bourne, Director of the Department of Public Safety. I just want to give a brief perspective from law enforcement. You know, law enforcement in Ohio, particularly the Highway Patrol, has interdicted and seized more drugs in the last 7.5 years than we ever have before. And there's two probably reasons for that. Number one, in 2011, we completely shifted the focus from the Highway Patrol writing citations. Not that citations don't have their place, but we were missing way too much. And we found out how much we were missing as we began those interdictions of large loads of heroin. The second thing that we did was we began to get collaboration from all the drug task forces. We fund, as a department, 43 drug task forces in Ohio, and for the first time ever in history, those drug task forces are at our collaboration level and communication and sharing data. We also embedded National Guard counter-drug intelligence analysts within those. And between the Highway Patrol interdiction, which is obviously the traffic stop, and then working your way back through that original source, we've had dramatic impacts on the supply. And that really hits at the overall goal of law enforcement, and that is to disrupt the supply, both increasing the cost and increasing the risk and impacting the overall business model. As Colonel Pride of the Highway Patrol says, trying to make Ohio, now the Midwest, and soon the entire United States unattractive to the drug business was our goal. And because of that, we know that we have shifted not only distribution methods, but also the amounts that they're hauling. So where I was a colonel of the Highway Patrol, it was not unusual to see us see double and triple digit seizures of heroin, but now the loads are much smaller, and in many cases they're moving them around Ohio. Now that obviously shows progress on the supply side. We know ultimately the long-term solution to this is on the demand side. The last thing I would say is that law enforcement is a great indicator of potential problems into the future, and what we've seen in the last couple of years really is a shift towards methamphetamine and specifically the very pure crystal methamphetamine that's coming out of the southwest border, as well as cocaine. And we're seeing the organizations that are mixing in some of those deadly combinations of fentanyl and carfentanil into those drugs. So that's a perspective from law enforcement. It's my privilege now to turn it over to the governor.
Thank you, John. I want to thank everybody who's been involved in this effort. A lot of people to be commended. There is a perception, I may be incorrect about this, that somehow this problem of drug abuse in our state is raging out of control. That is simply not true. We are beginning to win a number of the battles in the war on drug abuse. And let me just put it to you clearly. We have an 8-year low on prescribed opiate deaths, an 8-year low. What that means is it's not growing. It means that we're winning. We're starting to beat this down. So when we saw an unrelenting increase in prescribed opiate deaths, those days are over. Secondly, many of you would know that when you would go to the dentist, for example, not to pick on any one particular specialty, but it would not be unusual with some wisdom teeth pulled or whatever to see somebody with 20, 30, 40 OxyContins. That doesn't exist anymore. If in fact we have a doctor or any prescriber in this state that is violating our guidelines, they risk their license and even potentially a worse fate. We've also seen, as a result of the prescribing guidelines, a 30% decrease in these pills, the doses. So you take an 8-year low in prescribed opiate deaths, you see a 30% decrease in the amount of doses, which means that it is more and more difficult for someone to be able to secure large amounts that can lead to opiate addictions. We're starting to see this work. An 88% decrease in doctor shopping, and the stunning statistic to go from 2,000 ORS checks to over 500,000 today is remarkable. Now, we also see, by the way, a 4-year low in heroin deaths. But as John Bourne points out, it's methamphetamine today, it's heroin that's laced with fentanyl, and we heard here earlier about cocaine and the ability for those who are coke users to find themselves in a situation where they have secured supply laced with poison that will kill them. Now, the reason why it's so important to distinguish between the prescribed opiate deaths and total drug deaths is this is what we can do as a state to deal with the problem of the prescribed opiates. We can have the system in place to check who's writing what, who's receiving what. We have the ability to impose guidelines in terms of not just acute pain, but also now with new guidelines for chronic pain. So anyone who is in chronic pain, you don't have to be in a situation where you can't get what you need, but it has to be legitimate. So by doing all these things, all these actions, the guidelines, the ORs, the ability of people like Denise at the pharmacy to use this, to be able to work together as a community, all the prescribers, whether they're nurses, whether they're doctors, whether they're dentists, it doesn't matter. Across the board, we're now starting to see these good results. And I'm beginning to hear from people around the country that they're beginning to recognize that Ohio is a leader in this. Sometimes I wonder if in Ohio we know what we're doing, or we don't report the accuracy of the fact that we're winning. That doesn't mean we fly a banner that says mission accomplished. But every once in a while, I think it's important for the public to see that there are bright spots, for the public to see that the sun is breaking through. My message to all Ohioans, but particularly to mothers and fathers, to men and women, that they should hear and, of course, communicate to their children is no more street drugs for any of you. Do not think that it is risk-free to play with this demon called drugs. When it comes to the prescribed opiates, that is the gateway to these more serious drugs. So not that they are serious, but it is the gateway to heroin, cocaine, methamphetamine. That is the gateway. That's what you go through. People don't just wake up in the morning and decide to shoot heroin. It doesn't work that way. So by getting on top of prescribed opiates, that's why we're beginning to see the progress on a 4-year low on heroin deaths. People are not using like they used to use. The other message is, with prescribed opiates beginning to get under control, do not go out and illicitly solicit these drugs. You may think, some of you may think that, oh, I can handle this. I can take the meth, or I can snort coke, or whatever it is. Understand today, you are putting a revolver to your head. And in some respects, it's like that old thing we saw in the movies where we don't know where the bullet is in the chamber. What is it, Russian roulette? Well, let me tell you, you may go out and buy these drugs on the street a few times where it would be safe, but there is a bullet in that chamber. And if you do it enough, you're going to kill yourself. So I want to thank the whole community. I want to thank all of the staff that has worked so tirelessly on this. I thank the community because it could have been more difficult. People could have resisted this. What is hard for me to understand, and I think, Denise, you said this best, what are the other states doing? I don't know why they're not aggressively pursuing these things. It costs too much money to not deal with this. And we're spending about $1 billion on all of this, about $600 million on treating these addictions. And it's never going to be enough money. The key is to stop the demand. We can't stop all the flow, but to stop the demand. Now, we have had meetings with law enforcement throughout the country just about a week ago. And we are going to have improved communication and interdiction efforts here in America between the states. We need to make sure that we have a secure border where these drugs cannot just find their way across, but that is extremely difficult as well. So we also need a program that reaches beyond our border into those areas where these drugs are created. And if we can do that, we're going to begin to see better gains across this country. I don't say this, tell you this news, or because somehow I want it to reflect well upon me. It doesn't really matter much anymore, does it? Because I'm leaving. I say this because I think when people come together and they're of goodwill and they work together to fight an evil, great things can be accomplished. We're not done yet. But I would hope for the next administration, they would continue to look at the weaknesses in our system, that they would continue to stay on top of all of these issues, to work with the community so that we can have even more improvement. But we're winning, and I think the people of this state need to know that.